Should beta blockers be started before surgery? Could they actually do more harm than good? Stick around if you want to learn more about the surprising results from the POISE trial and an unexpected twist. Surgery is a stressful event, and we know that under stress, our body releases more stress hormones like catecholamines, such as epinephrine and norepinephrine. Norepinephrine and epinephrine bind and activate beta-1 receptors. Activated beta-1 receptors cause increased heart contractility, meaning the heart pumps with more force, beats faster, and as a result, increases oxygen demand of the heart. Of course, it would make sense to start a medication that could decrease blood pressure and heart rate. Beta blockers are a common class of medications that achieve these goals. Beta blockers bind to beta receptors and block their effects. Using beta blockers to decrease the heart rate and blood pressure results in less oxygen demand by the heart, which must lead to better outcomes in the postoperative period, right? Well, this is the question the POISE trial tried to answer. The POISE trial, or perioperative ischemic trial, was a randomized controlled trial conducted from 2002 to 2007 across 190 hospitals in 23 different countries. It was published in The Lancet in 2008, and the link to the article is in the description below if you want to check it out. Who was included in the study? The trial selected anyone undergoing a non-cardiac surgery that was expected to stay in the hospital for at least 1 day postoperatively. All individuals were 45 years or older with at least one risk factor for cardiovascular disease, like a history of peripheral vascular disease, stroke, heart attack, or congestive heart failure. 8,351 patients were randomized to either receive extended-release metoprolol versus placebo. EKGs and clinical monitoring were completed at specific points for 30 days postoperatively. The endpoints looked at cardiovascular events and non-cardiovascular events in the postoperative period. POISE showed beta blocker therapy resulted in significantly less heart attacks, need for cardiac revascularization like heart catheterizations with stent placements, and new significant atrial fibrillation. To put the positive effects of beta blockers in perspective, for every 1,000 patients undergoing non-cardiac surgery, beta blocker therapy prevented 15 patients from having a heart attack, 3 from undergoing heart catheterization, and 7 from developing significant atrial fibrillation. However, there is a twist. Beta blocker therapy resulted in greater total mortality, stroke, clinically significant low blood pressure, and low heart rate. Interestingly, the beta blocker therapy group had a higher risk of death related to sepsis and infection than the placebo group. The likely reason is that beta blockers mask the common early signs of infection we monitor in the perioperative period, like an elevated heart rate. So for every 1,000 patients, beta blocker therapy led to more than 8 deaths, 5 strokes, 53 having significantly low blood pressure, and 42 having significantly low heart rate. So what are the 3 key points to take away about beta blocker therapy in the perioperative period? 1. Beta blockers are helpful in preventing heart attacks, but also significantly increase the risk of death, strokes, and low blood pressure in the perioperative period. 2. For those that are on chronic beta blocker therapy, beta blockers should be continued as other studies have shown outcomes are worse if they're discontinued. 3. Those that are found to have a need for beta blocker therapy just prior to surgery should likely delay surgery. For example, newfound hypertension, atrial fibrillation, etc. should be started on a beta blocker therapy per guidelines, and their blood pressure should be monitored for 3 to 4 weeks to make sure they are well controlled without significant side effects. When they are stable on the medication, then they should proceed with surgery. This minimizes the side effects and adverse events that can be associated with beta blocker therapy. Well, I hope you learned something about the management of beta blockers in the perioperative period. If you did, please give a like, share, and subscribe, as it really helps support my passion for teaching. To learn about the most frequently missed form of heart failure, check out our video here. I'm Dr. K from iMedicalSchool, and remember to keep learning.